Department of Health, they say that the delay in the delivery of the Johnson & Johnson vaccine is due to the challenges that are being faced at the United States plant. The Deputy Director General in the Department of Health, Dr. Nicholas Crisp, says they hope that the country will receive its next batch of vaccines in the next phase. This was during a conversation we had with him a bit earlier on this afternoon. Let's listen in.
Well, I think for Johnson & Johnson needed to get their whole global supply reorganized after the challenges they'd faced with the emergent plants in the United States. And with the rulings of the FDA, they had to destroy quite a lot of the stock that came out of that source environment. So it's taken Johnson & Johnson a massive global realignment to get themselves ready. And we are one of the customers in that chain. We are fortunate that Johnson & Johnson uses a local South African factory for its finish and fill. So, you know, we are hopefully not too far on the logistics chain for that. But there are processes that have to be followed and commitments that need to be made. And we are hoping within the next few days to receive our next lot of Johnson & Johnson. Clearly, we've got the 1.5 million that were provided on the short expiry date basis to help us to recover when the problem was initially relieved. And we have allocated all of that vaccine to various programs and communities, and they are busy rolling out at the moment. So we are looking forward to more Johnson & Johnson vaccine doses in the not-too-distant future.
Let's move this conversation forward, and to do that, we're joined by Fatima Hassan, who's Director and Founder at the Health Justice Initiative. Good to have you with us this afternoon, Ms. Hassan. You, as the Health Justice Initiative, have been very vocal about your concerns regarding Johnson & Johnson. You've just heard the interview that we had earlier on with the Deputy Director General in the Ministry of Health regarding the reasons why there is a shortage of Johnson & Johnson in the country so far. Your response to what he has to say.
Good afternoon, Thami, and great to be on the show. And I just want to, say thank you to all the journalists working in South Africa to tell us what is going on in our country right now. And we just want to acknowledge that and say thank you for all the work that you're doing. And thanks for asking these questions to the DDG. I think what concerns us is, we need to get information on a daily basis from the Acting Minister of Health and the DG of Health. We believe that there is something amiss with this particular contract, which is why, as the Health Justice Initiative, we have now taken legal routes to try and get a copy of the contract. We don't believe that secrecy in the middle of a pandemic is actually going to help us, because the delays, whatever the reasons may be, are basically causing a severe derailment of South Africa's vaccine program. You only have about 2.5% of people fully vaccinated with J&J, whereas if you look at the Pfizer first dose, it's already been given to about 8.5% of all adult people in this country, with about 1.8% receiving the second dose. So while Pfizer is giving us supplies, inadequate as they may be, at least they're coming in on a weekly basis. And, frankly, I think that the information provided by the DG is not enough. We need to hear from the CEO of Johnson & Johnson. We need to hear from the CEO of Aspen to tell us exactly what is going on. And if it means that Johnson & Johnson cannot meet supply needs and they cannot provide what they contractually are obligated to, then I think it begs the question of why aren't we taking other forms of action against Johnson & Johnson, including insisting that they share the technology, that they transfer it, and they allow as many manufacturers as possible to start making the vaccine, not just for South Africa, but also for Africa.
And talking about manufacturers being able to make the vaccine, according to your knowledge, when will be the starting date or the capability of the Gqeberha plant being able to manufacture vaccines for South Africa?
So they're already manufacturing, and I suppose the issue is that they're having to rely on the active pharmaceutical ingredients, or what's called the APIs, coming from different places around the world because they don't have a full manufacturing license. This is the issue we've been raising for months, that Aspen does not have a full manufacturing license. They only have a fill and finish license, which means that all of our supplies and the supplies for Africa are basically now dependent on APIs that are coming in from other countries, which is why what happens in the US or at the plant in Baltimore affect South Africa's rollout as well as the rollout of the Johnson & Johnson vaccine for the rest of Africa. But, there's something which I think is a bigger issue at play here, and how is it, which is really the issue of how do you have a pharmaceutical company not sharing information? How can we be procuring vaccines on the basis of a secret contract? There's no details. When the minister was asked, I think, or the DG was asked a few days ago by Bekisisa around when the supplies will actually be coming in, they were told that they are not at liberty to say, which is why we are stressing and emphasizing that something is amiss, we believe, and that we actually need more transparency and information around this contract that has been entered into with Johnson & Johnson and Aspen, and what it means, the implications for the commitments that Johnson & Johnson made for quarter 3. They're supposed to be giving us 14 million doses in quarter 3. In quarter 4, they're supposed to be giving us 19 million. Now, the president a few days ago announced that there's a possibility of a full manufacturing license being negotiated, but that's just still taking too much of time. So, the real issue and the real question has to be, I think, at the door of Johnson & Johnson and at the door of Aspen to actually tell the public, to take us into their confidence, what exactly is going on. Why do we only have about 1.5 million doses from Johnson & Johnson? This is unsustainable. If it means, again, that J&J can't meet supply and can't meet the demand, then we may have to select other vaccines for South Africa's vaccine program.
We've had SAHPRA's approval of Sinovac. Where does that stand as far as availability and usage in the country?
So that, I suppose, depends again on the Acting Minister of Health telling us what the latest advice is from the Ministerial Advisory Committee, as well as the MAC that has been set up to advise it on issues related to vaccines, and where the government is actually going to select that particular vaccine for the vaccine program. But I think it goes, the issues around J&J and the supply crisis goes to the heart of why the South African government and Indian government asked for the TRIPS waiver, that if you had a relaxation of IP and you had a true sharing of knowledge and a transfer of technology, you wouldn't only have to rely on Aspen. You wouldn't only have to rely on 8 or 9 different companies around the world to make the J&J vaccine. You would have been able to totally change the landscape of manufacturing partners who would have been able to make this vaccine. And so it's the clearest example yet of what happens in a pandemic if you don't share that knowledge and you don't transfer that technology. It affects entire national rollout programs like it is currently in South Africa.
I'd like us to put things in perspective here, Fatima, for a moment. We've seen the rioting and the looting. We've seen a number of vaccines being destroyed in that process or being stolen. With that in mind, how has the unavailability of the Johnson & Johnson vaccine actually affected government's efficiency in the rollout process?
Thanks. So I think 2 things. So one is that had we had sufficient supplies of the J&J vaccine and also the Pfizer vaccines about a month ago, I think that our vaccine program would have been in a very different situation. You'll remember that the Johnson & Johnson vaccine was identified by government, and they said this publicly as well as in their briefings to Parliament, that the J&J vaccines would be used in difficult-to-reach areas, in areas where administering a 1-dose vaccine would be much more easier, and so that's what they call our neglected or rural parts of our country. And so it had a knock-on effect on the ability of government to scale up the vaccines in those parts of the country. The net result of not having enough J&J 1-dose vaccine basically supplies in the system is that we're now having to roll out a 2-dose regimen of the Pfizer vaccine to as many people as possible in all parts of the country. So it's had a knock-on effect in that way as well. So the riots and the violence and the destruction and the looting of vaccines also means that when you have limited supplies of vaccines in the system, because we don't have a lot, we have less than 10 million even jabs, even probably less than 7 million jabs in the system, and we've used a lot of them already. And remember, there's a few million people that need to still get the 2nd dose of the Pfizer vaccine. It means that you basically dilute further the available supplies, and you make the scarcity even worse. Because it's not like we're sitting with a warehouse of 20 million vaccine doses somewhere, right? Where if you lose a few hundred, it's okay and you can absorb that loss. For us, every vaccine lost at the moment means that somebody with a comorbidity or somebody who really needs a vaccine is then unable to get it.
Well, we'll leave it at that for this afternoon. Ms. Fatima Hassan, she is founder and director at the Health Justice Initiative. As Dr. Crisper said, the DDG and the Department of Health, that in about a week's time we should be anticipating the arrival of the Johnson & Johnson vaccines, and we'll certainly be keeping you abreast on developments on that front.